Hello, I'm Kelly Ray Powell. Sarah has asked me to speak for about 15 minutes about music therapy and oncology. And luckily, I presented at John Stoddard at the Oncology conference in 2020. So I'm just going to share a little bit, excerpts from the presentation that I provided. Just a little bit about myself. I am a music therapist. I have my master's in music therapy from New York University. I graduated in 2012. I earned my license to be a creative arts therapist in the state of New York in 2015, and shortly thereafter moved with my family to Ankeny, Iowa, where I grew up. And at that time, September of 2015, I had the opportunity to develop under the Child Life Department. I developed a music therapy program at Blank Children's Hospital. Currently, I have a private practice, Central Iowa Music Therapy, and I'm contracted by Shine to provide music therapy to patients who are receiving Shine services at Blank. So I'll just dive into this. I have my PowerPoint behind me, music therapy and oncology. I'll give you the definition of music therapy as stated by the American Music Therapy Association. Music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. Okay, so what does that mean? Music therapists must have a bachelor's degree or higher in music therapy from an AMTA-approved college or university. Music therapists must have 1,200 hours of clinical training. I received my clinical training. My internship was at Memorial Sloan Kettering Cancer Center in New York City. Music therapists must hold the MTBC credential issued through the Certification Board for Music Therapists. This protects the public by ensuring competent practice and requiring continuing education. Some states also require licensure for board-certified music therapists. Music therapy is an evidence-based profession with a strong research background. And music therapists have education in psychology, music, and medicine. And I do have to state, music therapists do not own music. Music is used by so many of us in our daily lives to energize us, to nurture us, to relax us, to help us wind down from a difficult day, to celebrate. Music is not owned by music therapy by any means, but the use of music for therapeutic means does not necessarily mean this is music therapy. For example, an Alzheimer's patient who's listening to an iPod of their favorite songs, that's not music therapy. It's therapeutic use of music, but it's not music therapy. An artist in residence is not a music therapist. A musician who's a volunteer, that's not music therapy. Nurses playing background music for patients, this is all very therapeutic uses of music, but it's not music therapy unless a credentialed music therapist is using the music as an intervention to achieve a specific goal. Music therapists have worked with Congresswoman Giffords, for example. Her music therapist teamed up with her speech pathologist to retrain her brain to speak. We work with older adults to lessen the effects of dementia. Music therapists work with children and adults to reduce asthma episodes. We work with hospitalized patients to reduce pain. We work with children who have autism to improve communication capabilities. We work with premature infants to improve sleep patterns and increase weight gain. And actually, a recent study found that NICU patients who receive music therapy are discharged sooner than other patients in the NICU. Music therapy is a pleasant, cost-effective, non-invasive modality that is free of side effects, and current evidence advocates its use in cancer treatment. This is a quote from an article by my supervisor, Karen Popkin. She wrote for Memorial Sloan Kettering Cancer Center. There are many benefits of music therapy and oncology. There are several studies that have evaluated and documented the value of music therapy in reducing the challenging symptoms, both physiologic and psychological, experienced by cancer patients. This is a quote from the same study in 2017. Some of the benefits of music therapy in oncology include beneficial effects on anxiety, pain, fatigue, and quality of life, small effects on heart rate, respiratory rate, and blood pressure, reduction of mood disturbance, improved coping and social integration, lowering preoperative anxiety, and reducing breathing problems in patients receiving hospice care. Music therapy can happen at the bedside or in family areas, in groups. Music therapy happens in outpatient clinics and in private practice. And there are many interventions that music therapists utilize: music listening, experiential music, singing, movement, drumming, song discussion, guided songwriting, music-assisted relaxation, lyric analysis, and guided imagery and music. So I'll share a couple case studies with you to help illustrate all of this long list of interventions. It's excellent because music is so personalized to each person. We each have a soundtrack for our lives. So music therapy can look very different from one patient to the next. And it depends on the patient's interests and where they're at in their treatment. So I met this one woman at Sloan Kettering. I was an intern still, and she had two of her best friends in her room with her, and she was relapsing. And they were some raucous gals. They were laughing. They were trying to cheer up their friend. One of them had brought cookies and was trying to give me a cookie. And they wanted me to play songs from their youth. And I did. And we all sang and danced. And they asked me to come every week when they were visiting their friends so we could have a girl party, is what they called it. So during this woman's treatment, I think she was 64, during her treatment, I would visit her with her friends, and then I started visiting her when her friends weren't there. The nurses would refer me if she was feeling anxious, and she often used music to cheer herself up. But she also shared a song, Bye Bye Blackbird. And she didn't share why she loved it, but towards the end of her treatment, she started asking me to play that song for her more often. She died when I was meeting her, and in our very last session, her husband was reticent to let me into the room. He hadn't met me, but I knew that she would want to hear that song. So I was assertive, and I made sure I checked with her. She couldn't speak at this time, and I asked her to hold up a finger or a number of fingers to represent how many songs she would like me to play for her that day. She held up one finger, and I knew which song to play, and I did. And while I was playing it, she just beamed at me. She smiled at me. Her husband began to weep. And she did die later that day. But it was a beautiful example of how her husband, who was, when I met him that day, he was against having music therapy that day. My wife is in pain. Like he was feeling very tense, very frightened. And it was coming across as anger. But through the music, he was able to cry and express his sadness and feelings that he was having surrounding this very big moment in his and his wife's life. And he did embrace me. He hugged me, and he asked me to come back later if I could. And the music changed the entire feel of that space. Especially since it was obviously a song that was meaningful to that couple. There's also a gentleman I was seeing. He was being treated for leukemia. He was younger. He was probably 55, I think. And often when I would visit him, he and his wife would be at the bedside, and he used humor as a coping mechanism. And he loved to put forth a brave face. But the nurses had referred me to visit him because they could tell he was very anxious, as anybody would be. Leukemia treatments are difficult and frightening, and it was unsure. His prognosis was it was unsure. So there was a lot of questions surrounding his treatment and fear surrounding his diagnosis. His daughters were older. They were at school, so they weren't often there when I visited him. But he used music for meditation. He found it calmed him a great deal and helped him feel more grounded. And he reported feeling less pain when I would give him a meditation. I would provide a meditation. Often I would use acoustic guitar, and I would just play 2 very soothing chords, and I would lead him through a body scan meditation. And he requested my services at least once a week, usually twice a week, because it was so effective for him to manage his anxiety. He and his wife also used music to sort of review their life together. And at the end of each session, they would ask me to play When You Say Nothing at All by Alison Krauss. It was their song. And when he was actively dying, his wife asked me to play that song for him as a way for her to tell him goodbye. He could no longer speak at the time he was intubated. And the day he passed away, I was able to play that song for him and for his wife, and his daughters were there. And they all held hands and sang the song with me as he died. The staff sang as well. It was an amazing way for them to tell him that they loved him, even though he could say nothing at all at that point. It was incredibly powerful. If you have any questions about music therapy, don't hesitate to contact me. Obviously, music therapy can be a receptive experience where I provide soothing music to help manage pain and anxiety, but music therapy can be active, it can be collaborative, songwriting can happen, and instrument learning can happen. I love teaching clients how to play the ukulele. It's such a fun and easy instrument, and it's just a really beautiful way to pass the time. Not just to pass the time, but to create meaning, to take a crisis that the patient is going through and give it some kind of meaning. You can feel free to email me if you have further questions. I have a Unity Point email, Kelly, Kelli, .powell@unitypoint.org. And I have my private practice email is Kelly, Kelli, @centraliowamusictherapy.com. Thank you for this time. Thank you, Sarah, for having me. Have a great day, everyone.